Welcome back, subbies, or welcome to our channel. If you're new, I am Sherry, and welcome to Talk on This. Guys, today we are going to talk about Lisa Marie Presley's autopsy results. These are finally in. Now, the Los Angeles County Medical Examiner's Office reported that the cause of Lisa Marie Presley's death was small bowel obstruction that was in the form of a strangulated small bowel. Now, this was caused by adhesions that developed after bariatric surgery years ago. Now, Lisa Marie Presley had weight loss surgery. She had the most intense kind of bariatric surgery. They actually bypassed part of her intestine. They made a new connection between the stomach and her intestine. So they cut away apart, and this was crazy. Um, because most people will get the sleeve on the stomach, but she did the most intense kind. And because of this, adhesions developed on the internal surface of her small bowel. Now, adhesions actually appear when the body is trying to heal itself, repair itself. They develop when the body is attempting to heal itself. And, this is normally after surgery or infection or injury or some sort of trauma, or even radiation. And this was so sad. Now, everyone knows Lisa Marie Presley as Elvis Presley's daughter. Now, Elvis Presley himself was overweight as he got a little older. And Lisa Marie mentioned how his side of the family was always unhealthy and died early, and she did not want this to happen to her. So she was really set against gaining weight and becoming obese and dying at a young age, like her father did. She was so against this. She did not want this to happen, but yet it ended up that way, and it's so sad because she was fighting against this. And Lisa Marie is very small. She's only 5'2.5". She's very petite, and she's always been very petite. And so when she puts on weight, you can actually see it. It shows up, and you can see it very, very obviously, and it was very obvious. And she felt uncomfortable in her skin, so she went this drastic route of bariatric surgery. And what happened is the adhesions actually caused an obstruction in her bowel. Now, adhesions actually, when they adhere or stick to the internal surface, they constrict that surface, and that can actually cause a obstruction. It constricts the surface. Now, adhesions could be as thin as like plastic wrap or as thick as a fibrous band. So, it could be very thin or very thick, and like I said, it constricts the internal surface that it's on. All of this caused an obstruction in her small bowel, which actually prevented blood flow, and her internal organs died. Now, before she made it to the hospital, 30 feet of her intestines had died before she made it to the hospital. This was crazy. She actually went into cardiac arrest that day. She was complaining of stomach pains that day. She went into cardiac arrest. Her ex-husband, Danny Keogh, revived her. Well, he resuscitated her. He got her heart going, but she died that day in the hospital. She was in an induced coma and never came out. They did not bring her out of it. She was brain dead. They took her off of life support. And this is so tragic, the very thing that she was trying to prevent, dying early at a young age. Like her father's side of the family actually happened to her. Like I said, Lisa Marie has always been small, always a small frame, and she hated when she had weight on herself. And, she spoke to People magazine, and she told them, she, after her weight loss surgery, she felt that she was back into her teenage weight, and this was the best feeling ever. And she could wear so many different clothes now, and she was feeling great. She was really back to the weight that she was when she was a teenager. And she talked about eating healthy foods. She mentioned to reporters that she would eat like avocado toast with feta cheese and spinach. This sounds very good. And, she would walk 30 minutes every other day. When she was on tour, she would, you know, have these excruciating tours, and then she would still try to walk, and then with her kids at the time, her twin kids, her twin girls, she was really active. And this also helped her with her weight loss. But unfortunately, her impatience with trying to lose weight led to this choice of choosing to go the quick route, bariatric surgery. Now, it's a personal choice. I personally would not want to go this route to lose weight, but it's a personal choice and people do it. But it gives fast results. And sometimes you need to be patient in losing weight. People go the bariatric way and then they start to eat healthy and whatnot. But, the deed has been done, especially when you do these drastic measures. Some people just put on the sleeve, but Lisa Marie went really drastic. And it's so sad that it was not caught early. Now, she had 2 opioids in her system, oxycodone, but it was at therapeutic levels, and buprenorphine, buprenorphine. I hope I pronounced that right. buprenorphine. Now, this is used to fight pain along with oxycodone, but buprenorphine is also an opioid, helps to fight opioid addiction. So she was using this to probably help crave her addiction to opioids, which she has had a problem with in the past. She has been addicted to opioids in the past, and she was probably taking this to help with her addiction. Now, like I said, the opioids in her system, the 2 opioids, were at therapeutic levels, and these were in her bloodstream, not her urine. Her urine toxicology came out clean, which shows that she was not using she was not abusing these opioids, or not. She wasn't using them in an abusive manner. Strictly probably for pain and also to help with the opioid addiction. And this is probably what helped mask the pain of the adhesions that were blocking off her, blocking off her, or strangling her intestines. This pain that she had was probably being masked by the opioids, and to such an extent that she did not think of it as so intense as to get further help. Or maybe she did seek further help, but why didn't doctors investigate further into this problem? Why did 30 feet of her intestines have to die before she even made it to the hospital and she was dying? This could have been prevented. I don't understand why she did not seek help earlier. I'm sure she was in pain. This is why she was taking pain medication. She may not have realized how serious it was. If she did seek help, why didn't the doctors investigate further, especially after she had such a advanced, invasive surgery? It's all really crazy, and it just didn't have to happen. There was also another medication in her system, quetiapine. This is an antipsychotic medication. Not sure why this was in her system, but she was obviously on antipsychotic medication. And I don't know if this was for depression or what was happening. I don't know what it was for, but hallucinations, I don't know. But it's so sad that she had to be taking these medications, and had to be the result um, of everything that happened from this surgery to, um, you know, just you see her when she started off um, in her weight loss fight. She was losing weight. She lost weight. She looked great. And just a few years later, she looked frail and thin at the Golden Globe Awards. She was with Austin Butler and her mom, and at the Golden Globe Awards, and she looks so frail and thin, and it's just almost a walking dead person. She looked terrible. And in just a few years, from being so thin and happy, and just in a few years looking um, thin and frail and unhappy, and just, it's so sad to see. And it's it's so, did not have to go this way. In my opinion, I feel that people have choices they make, either life or death choices. And a lot of it has to do with patience and not rushing things. Lisa Marie Presley wanted to lose weight really quickly. In my opinion, she was not even overweight to that extent, where she could not have just exercised and ate properly and lost the weight without having to do surgery. But it was her personal choice, and this choice eventually cost her death. And it may not have been the choice of bariatric surgery, but the fact that it was not followed up properly. If she had the surgery and there were adhesions, this could have been detected earlier. And it's sad that because of the medication, probably this problem wasn't detected and solved. It's sad that there was no follow-up from the doctors after this surgery with her. Did she mention she was having pains to the doctor? There's so many questions, but it probably did not have to go like this if proper follow-up was done, and proper communication was done between her and doctors. And it's just so baffling. And we just have to remember and just take a look at her life and learn from her life about being patient and not rushing probably into drastic measures that can possibly cause our life to end. Another thing with opioids is it slows down the intestine, meaning it causes constipation. And this probably could have also been a cause of her pain as well. Her father was on opioids as well. He was found in his bathroom dead. And it's so sad how, you see this tragic generational curse pass on, even with the death of her son, the suicide of her son. It's just a tragic generational curse that hopefully is can be broken by her kids and not continued on. And there's also another thing I wanted to mention about these weight loss surgeries and drugs. Now, there's a drug injection called Ozempic injections, and these are now being used by people in Hollywood and other places, for weight loss, quick weight loss. And this is actually an injection for type 2 diabetic patients, or people who have type 2 diabetes with a heart condition. And this is used to control blood sugar for persons with type 2 diabetes with a possible heart problems. to prevent strokes or heart attacks. Now, Ozempic injections have been known to cause rapid weight loss because of the controlling measure it has with blood sugar, and a lot of people are now getting Ozempic injections and ending up in the hospital. All these quick fixes are so unnecessary, and we just need to learn from Lisa Marie's life and death that all we need is patience, just patience, and go about it the right way. Anyway, guys, check out the video I did with her at the end of this video. I'll leave the link at the end. And I just did it on a whim because I was thinking about her, and now all of this is happening, and it's really sad. But we can learn a lesson from her life. Anyway, guys, let me know your comments. What do you think about weight loss surgery, bariatric surgery? Would you do it? Is it needed? Is it just a quick remedy for something that we have the strength within ourselves to do? Let me know your thoughts. Anyway, until the next video, be safe and be blessed.